Dr. Paul Mason. Vegetable seed oils are shown in studies to damage our metabolic health.
If you are metabolically healthy, you can undergo an oral glucose tolerance test with almost zero deviation of your sugar supply. So to talk about people who are metabolically healthy with extreme glycemic variability is an oxymoron. People who are metabolically healthy don't tend to have that degree of glycemic instability, full stop. So I actually, when we debate about whether it's possible to reverse type 2 diabetes and people say it's only being controlled on a healthy diet, it's not actually being reversed. No, that's not true. I've actually done hundreds of glucose tolerance tests with insulin, otherwise more commonly known as the Kraft test, and I've got multiple patients who have actually been able to restore flat glycemic control in response to a 75-gram load of glucose.
Kraft test. It goes well beyond the typical oral glucose tolerance test. It is 5 hours and checks both glucose and insulin levels throughout the test period.
Now, number two, we actually have solid evidence from the mitochondrial level that there is oxidative stress that is generated when glucose is a source of fuel. And the greater the flux of glucose, the greater the oxidative stress. We've got ground level, almost molecular level data confirming that. And then we have experimental data that also shows that. So we actually know that vegetable oils are oxidized. And when you consume them, you actually have these circulating oxidized molecules in the blood that we can measure. We can actually measure the oxidative load after somebody consumes a load of vegetable oil. And then they did a very nice study. They got subjects who were either insulin sensitive, which means their insulin levels worked well and their glucose levels were well controlled, or insulin resistance, which means that their sugar levels were going up and down. And then they gave them the same load of oxidative stress. And they found that there was a huge increase in both the amplitude of oxidative stress in those people who are insulin resistant that persisted for well over 24 hours after one meal of seed oils, oxidized seed oils. And for anybody who's thinking, oh, that's good, I don't have any oxidized seed oils, by definition, if you're having a seed oil, it is oxidized. There's no other way for it. And olive oil doesn't escape either. The reason that these oils oxidized is because they've got these unsaturated bonds. The only difference between a polyunsaturated oil and oleic acid, which forms 70% of olive oil, is that there's only a single bond prone to oxidation in olive oil, whereas there's multiple of them in seed oils. So olive oil is too prone to oxidation, just to a lesser extent by virtue of having less of these bonds. Saturated fats, by definition, they don't have any of these bonds that are prone to oxidation. So there is absolute clear evidence that this glycemic instability from a mechanism and from subjects who actually are insulin resistant with poorer sugar control, that actually does lead to these much higher levels of oxidative stress. And if you've got these oxidative molecules circulating around your body, have no doubt that they're reacting with some of your liver tissue. They're contributing to worsening your insulin resistance. Again, it's a vicious cycle, as well as potentially interacting with LDL molecules in your blood and damaging them and so on and so forth.
If you're metabolically healthy, meaning you're insulin sensitive, you can undergo an oral glucose tolerance test with almost zero deviation of your sugar supply. People who are metabolically healthy don't have glycemic instability. Dr. Mason says, I have done hundreds of glucose tolerance tests with insulin, which is called the Kraft test. Numerous patients have been able to restore flat glycemic control in response to this 75-gram load of glucose. Kraft test. It goes well beyond the typical oral glucose tolerance test. It is 5 hours and checks both glucose and insulin levels throughout the test period. There is solid evidence from the mitochondrial level that oxidative stress is generated when glucose is a source of fuel. The greater influx of glucose, the greater oxidative stress. We know that vegetable or seed oils are oxidized. When you consume them, you have circulating oxidase molecules in the blood, we can measure the oxidative load. In one study, seed oils are given to two groups. One, insulin sensitive, meaning their glucose is controlled. And the second group, insulin resistant. Their glucose goes up and down. They were given the same load of oxidative stress. The result, the insulin resistant group had a huge increase in amplitude of the oxidative stress that persisted for well over 24 hours. All seed oils are oxidized. Olive oil doesn't escape this. The reason? They all have unsaturated bonds. Oleic acid, 70% of olive oil, has one bond prone to oxidation. Polyunsaturated or seed oils have multiple bonds. Saturated fats don't have any of these bonds prone to oxidation. Where can you find these saturated fats? All meats, especially red meat like beef and lamb. Dairy and eggs, fatty fish and other seafoods, coconuts. There is clear evidence that glycemic instability does lead to much higher levels of oxidative stress. If you have oxidative molecules in your body, they are contributing to your insulin resistance and damaging your LDL.